Today we learn everything about intravenous pyelography in this video. My name is Dr. Aishwarya. So first, what are the clinical indications for IVP? These are the indications which clinician sees and sends for IVP. If patient has hematuria, renal colic, recurrent urinary tract infection, suspected urinary tract anomalies, and in cases of proven hydronephrosis, they send for IVP. What are the contraindications for IVP? Any known allergy to contrast media is a contraindication. Pregnancy, of course, because radiation is used. Impaired renal function, that is end-stage renal disease, is a contraindication for IVP. So once we get the patient, what all we can detect with IVP? In kidney disorders, we can detect calculus, we can see renal contour and symmetry, we can see if there's any calyceal distortion like clubbing or loss of papillary impression present, and etc. In ureter disorders, we can see if bilateral ureters are symmetrical, we can see if any diverticula is present, we can also detect obstruction. And in case of dilatation and deviation of the course also, we can see in IVP. Bladder disorders, we can see bladder wall irregularity and diverticula, and neoplasms, if suspected, can be detected. To prepare the patient, we give the patient laxatives the previous night to decrease fecal loading so that bowel gas shadows are reduced. Patient should be fasting for 5 hours before the study and also measure EGFR. Be ready with emergency drugs to tackle any contrast reactions. Contrast media, what do we use? We use low osmolar non-ionic contrast, which is of concentration 300 to 370 mg iodine per ml. Dose for the patient will be up to 1.5 ml per kg body weight, and in pediatric cases 1 ml per body weight. Technique of injection, we inject through 18 gauge IV cannula rapid bolus technique. Coming to the procedure, first we'll take a plain film, then we give IV contrast. We take an immediate film, a 5 minutes film and 10 minutes film. Between 5 minute and 10 minute, we apply abdominal compression band, and after releasing the compression band, we take a release film. At last, we take a post micturition film. So how to take a plain film? We use KVP of 65 to 75 and MA of 600 to 1000. We take a classical supine AP radiograph of KUB region. So what is the importance of plain film? We can detect if any calculus is present in kidney, ureter or bladder. Next, we take an immediate film 1 to 3 minutes after IV contrast injection. This will help us detect the renal parenchymal outline because renal parenchyma is opacified. So we can also see if there is any possible neoplasm which causes outline distortion. This is how we can see the immediate film. It looks like a nephrogram. We can detect average length of kidney, which is normally 9 to 13 centimeters. We can also detect renal parenchymal thickness. Here we can see the renal outline of the opposite kidney. Once we determine the outline, we can see the renal parenchymal thickness. At interpolar region, it is supposed to be 2 to 2.5 centimeters, and in any polar region, upper pole or lower pole, it's normally 3 to 3.5 centimeters. Then we take a 5 minutes film. Now contrast will begin to appear in the pelvic calyceal system. Importance of this film is if any unilateral absence of contrast is there, we can suspect obstruction of that side, ureter or pelvic calyceal system. This is the 5 minutes film. We can see the contrast entering the pelvic calyceal system here. Next, we apply compression band midway between anterior superior iliac spines on the abdomen. This compresses the ureters so that the pelvic calyceal distension will be adequate. It's contraindicated in cases of recent abdominal surgery, recent trauma or large abdominal masses, etc. After applying compression, we take a 10 minutes film. Here we can find distended bilateral pelvic alical system. After releasing the abdominal compression band, we take a release film. Here adequate opacification of bilateral ureters can be obtained. This is the release film. Here we can see both ureters are adequately opacified and contrast enters the bladder. Then we take post-micturition film to assess bladder emptying. Importance is if any urethral diverticulum is seen, then we can detect. Additional films can be taken like delayed films in cases of renal obstruction up to 24 hours. For more such videos, follow us on YouTube and Instagram, Radiology Doodles.